This is not my mother's menopause.
This is not my mother's menopause.
This is not my mother's menopause.
Hi, I'm Laura, your host for the series, This Is Not My Mother's Menopause, What You Don't Know About Menopause, Hot Flashes, and Night Sweats. This series is about menopause and how it affects women, especially when symptoms of hot flashes and night sweats begin. This is the second segment of a 6-segment series focusing on the diagnosis, treatments, and management of menopause. In the previous segment, we heard from healthcare experts and women about menopausal symptoms, specifically hot flashes and night sweats. In this segment, we will hear from our healthcare experts and guests about their own menopausal experiences and symptoms. And we'll hear how race and ethnicity can affect what kind of symptoms women from different backgrounds and regions can experience during their menopause transition. So what is menopause? A clinical definition of menopause is the natural end of women's menstrual cycles due to a decline in the production of estrogen and progesterone hormones in women. In other words, it's nature's way of ending a woman's monthly menstrual cycle and her ability to get pregnant. You may have heard the terms perimenopause and postmenopause. So what is perimenopause? For most women, perimenopause happens in their 40s. Perimenopause begins several years before menopause. So for many women, this will happen in their 40s, but for some, it can even begin in their 30s. This is the time when ovaries gradually begin to make less estrogen. As estrogen hormones rise and fall, periods grow longer or shorter, and women begin to experience menopause-like symptoms. Menopause naturally occurs in women between the ages of 49 and 52. But the age women experiencing natural menopause can also vary widely from 40 to 58 years old. It also varies by ethnicity. Postmenopause is the time after a woman has been without a menstrual period for 12 months or 1 full year. During this stage, menopausal symptoms typically decrease or stop completely. The symptoms of menopause usually develop in the transition years. The most common symptoms are vasomotor symptoms, or VMS. Of those surveyed, 40% of women report feeling hot or cold. 17% experience night sweats. 16% say that insomnia is a symptom of menopause. 13% of women experience vaginal dryness. Mood disorders affect 12% of women in menopause. And 12% of women also report weight gain during menopause. In all, 85% of postmenopausal women have experienced a symptom in their lifetime. VMS are the most common symptoms associated with menopause, affecting more than 50% of women ages 40 to 64. The most frequently experienced menopausal symptom among whites, Hispanics, and African Americans were VMS. And among Asians, it was decreased sexual interest and increased joint and muscle discomfort. According to studies, Asian women experience the smallest number of symptoms, and African American women experience the largest number of symptoms compared with other ethnic groups. Of those surveyed, 53% of African American women were more likely than white women, 29%, to have experienced VMS. Factors associated with VMS included race, BMI, and dietary intake of fat and calories. To share with us some of the most common symptoms associated with menopause and the facts about VMS, like hot flashes and night sweats, is Janet Carpenter. She is a distinguished professor at Indiana University School of Nursing. She has been studying menopause for 25 years. She also will explain how heredity can be a big factor in how women will experience menopause and its symptoms.
Menopause does have a link with genealogy or heredity. so that if a woman's mother or grandmother has gone through an early menopause, which is typically menopause before age 40, that woman is also more likely to have an early menopause. Just like an artificial menopause, either through surgery or chemotherapy or medications, those are related to severe symptoms. And early menopause can also be related to more severe symptoms. So it's kind of this indirect relationship. Some women report muscle and joint and bone pain, and migraines can also be a problem for women. Some women who've had migraines before menopause will get relief of their migraines with menopause, and other women will actually start to experience migraines during menopause. And then there's a host of things that happen with women's vaginas. The tissue in the vagina changes, the microbiome in the vagina changes, and many women will feel vaginal dryness and need to use a lubricant to have comfortable sexual play and intercourse. In North America, we use the terms hot flashes and night sweats interchangeably, and as scientists, we tend to think of them as the same symptom. You know, over in Europe, the British call them hot flushes. It's all the same thing, this sudden rush of heat and sweating that women feel. I think the difference for women is that during the day, they feel that heat coming on gradually, or suddenly actually, that can happen. Whereas at night, that phase of the hot flash might actually happen while women are sleeping. And so they wake up once the hot flash has already hit, and they wake up with this feeling of sweating. Some women talk about drenching their night clothes or their bed sheets and having to, change a nightgown, change bedding during the night because of the night sweats.
You may be wondering what causes hot flashes and night sweats. This internal phenomenon involves a woman's hormones and chemicals in the brain.
Some of the racial and ethnic differences we see is in how women experience symptoms and also what symptoms they experience. So in the Hot Flashes Cool educational exhibit that I created, one of the things that I did is I used flowers on mannequins to show different places in the body that women around the world experience hot flashes. Some of my colleagues who are medical anthropologists have done this research where they've traveled to different countries and talked with women. And they've learned that women in Mexico, for example, feel hot flashes as a sticky sweat on the back of their neck. And women in Bangladesh, who often will wear headscarves, are more likely to report having a hot flash on the top of their head. Whereas women in the US and Europe, both African American and Caucasian women, will talk about hot flashes from their mid-chest up through their face. So even in terms of a hot flash, they can be felt differently. And then some cultures will report muscle and joint aches are common in Asian women as a main complaint.
Other health issues specific to women, such as decreased levels of estrogen after menopause, have been linked to increased rates of heart disease, hypertension, and obesity. Symptoms like hypertension can lead to serious health issues if left unaddressed by a healthcare provider. Studies have shown that African American women have disproportionate rates of hypertension that can be further complicated as they transition through menopause. Stress, coupled with depression and hypertension in perimenopausal African American women, has not fully been explored. Changes in women's body composition and weight gain or loss are additional symptoms of menopause. According to one study, Black and white women had similar patterns of changes in their body composition and weight after their final menstrual period. The same study showed Japanese women lost some lean mass during the menopause transition. But unlike white and Black women, they didn't gain fat mass. Uniquely, Chinese women gained lean mass and lost fat mass after menopause. Our next guest, Joyce Moy, is an Asian American Pacific Islander and a resident of Hawaii. She talks about her own personal experiences with menopausal symptoms. Joy is 75 years old and is retired. Sadly, Joyce suffered 13 miscarriages early in her reproductive years, and it was likely due to endometriosis, and she has no children. She had an emergency hysterectomy at the age of 36, and that caused her to go into early menopause. Joyce's menopausal symptoms began shortly after her hysterectomy. Joyce's healthcare provider put her on some synthetic hormones, but she was allergic to them, and she soon began to suffer from hot flashes and night sweats. In addition to those symptoms, Joyce was also suffering from a loss of appetite, nausea, and a reduced sex drive. Having started menopause so young, Joyce didn't really have any family or friends who could relate to what she was dealing with. Luckily, Joyce's family and friends stood by her, even though they were all learning at the same time through her experiences.
It started right away. They put me on synthetic hormones, but I turned out to be allergic to that. I would wake up in the middle of the night, it was like 2 days after surgery, throwing up dry heaves the entire night. The hot flashes were horrible. It was middle of winter, it was snowing. My husband, we had just gotten a new puppy. He lit the fireplace. He would sit in front of it with sweats on. I'm in the corner of the room with 2 fans blowing on me. I'm in, a t-shirt and shorts. And he goes, "Are you all right?" And I can just feel it was like hot flash and hot flush, if that makes sense. And I don't wish this upon anyone. It was so horrible. And it lasted quite a bit, and especially the fact that I couldn't take any hormones or do anything about it. I had to let everything run its course. So it was very difficult for me. I didn't have an appetite, only because I was so busy either throwing up or sitting there with hot flashes. I didn't feel like eating, not at all. Energy, it was normal, nothing different. Sexually, please, no thank you. At that time, I couldn't think of it, not at all. It took me a while, and my husband was very understanding. I was lucky. There were nights I just said, "Please, don't even touch me." A couple of nights I would sleep in the other bedroom because I just didn't want anyone around me, anyone touching me, because I just felt all clammy all the time. So everything took a good 6 months for me to finally kind of, accept what was going on. And then my mindset was a little bit different. And my friends were very supportive, my family, my friends, since I went through it all at a young age, and they had not gone through it. I would tell the women out there that it's going to go through menopause. It's something my brother said to me when I had my first miscarriage, and it covers basically everything. It takes both rain and sunshine to make a rainbow, and to use that through your life, and you would understand, and it brings peace. It really does, because there is a light at the end of the tunnel.
Though women may experience similar menopausal symptoms, their access to care and resources to help them through menopause varies among women. Another factor that contributes to how a woman deals with her symptoms depends greatly on her support system, like her family, friends, and even coworkers. Also, how comfortable she is with speaking with her healthcare providers. A study showed that African American women who grew up in the segregated South frequently expressed that their mothers provided them with the knowledge and power to negotiate difficulties during the menopausal process, while many middle-class Euro-American women said their mothers did not do the same. Our next guest, Edwidge Thomas, shared her personal experiences with hot flashes and night sweats as a healthcare provider and as a member of the BIPOC community dealing with menopause. Edwidge is 60 years old and is a nurse practitioner who lives and practices in New York City. She was born in Haiti, but raised and educated in the US.
So I have to say that wasn't a typical problem for me, the night sweats. But, very recently, so, I started my menopause in early 50s, but about a year or so ago, while we were making some changes with my medication, I had this experience of an intense night sweat that rendered me completely drenched. My sheets were drenched, and it was just awful. And as I think back, I realized both my doctor and I both realized it was because of this medication change. But for the most part, that hasn't been my experience with having sort of these night sweats that really disrupts my sleep. I would say my top 5 symptoms, hot sweats definitely was the lead. Secondarily, definitely with the word finding difficulties, which that one really struck me because it was a time in my life where I had just been hired in this executive position, had to do a lot of presentations. And, doing these presentations, I'm in the moment, or doing these meetings, I'm in the moment, and I'm finding myself struggling with finding words. And I remember sort of panicking to a point where it almost even developed a little bit of an anxiety. And I remember talking to my doctor about it and realizing that that's all part of the symptoms. The other was the weight gain, and not necessarily gain, but the distribution of weight. And, you hear and you read, like the evidence even tells you that a lot of the weight gain is around the midsection.
A woman's family medical history can also impact her menopause transition. It can give a woman a heads up on any cardiovascular or other potentially serious medical risks that may need to be monitored before, during, and even after menopause. Edwidge explained why it's important for her to pay close attention to her heart health and how she works at keeping a healthy weight.
Yeah, so for me, I've been extremely fortunate. I mean, I have to say I have a terrible family history. My mother died at 56 years old of a massive heart attack in her sleep. She suffered with hypertension, diabetes, and obesity from most of her life. Really, at the very last end, was able to sort of get her arms around it, and had lost a tremendous amount of weight, and then she ends up dying. So the hypertension, the elevated blood pressure, the elevated sugars, and the elevated cholesterol is definitely part of my family genetics. But for some reason or other, I just got, the better part of that gene. I don't suffer with elevated blood pressure or sugar. I see a cardiologist regularly because of the family history. I would want to say one thing further, though, is that I do think that, unfortunately, because menopause is such a taboo conversation, overall women are not having these conversations and are sort of silent about it. More specifically, I think that Black women, and we've been socialized not to complain. I think our entire sort of society sees Black women as being extremely strong and can tolerate pain. And then there's all sorts of evidence that talks about how not just Black women, but Black men, in terms of how the lack of pain meds that are given because our pain tolerance is very high. And I just want to say that, menopause is such an awful experience, regardless of your Black, white, or whatever ethnicity you are, that I encourage, as much as I possibly can, women of color, Black women, to really talk about some of those symptoms that you're having, especially around depression and anxiety and the brain fog. It's not just the hot flashes, because there's definitely support out there. There's definitely treatment out there. Menopause is still a taboo conversation. For women of my generation, it's just not something you talked about. It's something that you experience, and you experience almost with pride, without complaining about it. It's a badge of honor somehow for women not to complain about menopause, specifically for women of Haitian and Caribbean descent. I find that it just doesn't come up. I know that there's not been a lot of treatments out there to really support women, but I also think that it's just been a conversation that women over the years, by their mothers and grandmothers, have been taught, not to sort of talk about. Women of different cultural backgrounds, to them, it's about aging. And I find that I see that a lot with my Asian population. It just doesn't come up because it somehow references the fact that they're aging. And same with my white sisters. And I find that, talking about menopause, it's just something that we don't do, or they don't do, because of it sort of highlights the fact that they're getting older, and their value or their contribution to society somehow is perceived as lessened.
Unfortunately, women throughout the U.S. don't always seek treatment for their menopause symptoms because they are too embarrassed to discuss their symptoms with a healthcare provider, particularly if that provider is a man. Our next guest is Dr. Tripkovsky. His parents are from Macedonia. His interest in medicine and serving others comes from his family roots. Ancestors on both sides of his family were village doctors. He currently lives and practices in Hawaii, a state that sees its share of underserved and underrepresented residents, especially Hawaii's female population.
When we're talking about inequalities in healthcare, and if we focus on women, there are many. And those, in general, are due to inequalities in the healthcare system. The healthcare system is designed to take care of everyone, but sometimes people fall through the cracks. And I think this happens to women a lot. First and foremost, because of some of their issues, they have difficulties representing themselves or discussing these problems with a physician. Majority of physicians are men still, and I think they're uncomfortable. And so some of the inequalities related to them being more able to discuss their personal issues would be having more female physicians. And then also, women tend to be in a situation where they have problems because of their financial inequalities. So having financial inequalities leads to having poor or no insurance, and having no insurance or having inadequate insurance also leads to them not taking care of themselves adequately from the aspect of getting their routine things done and focusing on major problems that they might have. I'd like to see a way that all populations could focus on their health. And I think from the women perspective, if there is some shame or there's some bashfulness or what have you about certain healthcare symptoms or healthcare worries that they have, they should try to overcome them. But maybe there's something that we can do to make it more easier for people to understand that there's nothing to be ashamed of. Maybe we can focus on education or focus on somehow public service announcements or something that make people more comfortable, make them understand that they're not alone, they're not the only ones going through these kind of problems. And then seek, medical advice, get medical care.
We've spent this segment learning about the impact of the symptoms related to menopause and how race and ethnicity play a role in those symptoms. We've heard healthcare providers' perspectives and from women who have gone through the menopause transition. In the following segments of this series, we'll examine additional barriers to care, as well as information and stigmas, and treatments and therapies all pertaining to menopause. When it comes to understanding this transition in a woman's life, our goal is to help our audience have a better understanding of what menopause is, and to help them make better choices when it comes to the management of their symptoms and overall physical and behavioral health throughout the stage of their lives. Please join me for the next segment in this series. We'll see you soon.